my name is Julina Nakamura, and today I'll be speaking to you on the aging population and the long-term care crisis. Before I start my presentation, I'd like to briefly introduce myself. I'm a rising senior at Vista del Lago High School in Folsom, California, and I enjoy playing golf and softball on my school team. I volunteer at Mercy Medical Hospital Folsom, as well as Kogier Alzheimer's Center and my local food bank. In the future, I'd like to make a positive impact on global health throughout my career, and I'm particularly interested in oncology and neurology. So the goal of my presentation today is to raise attention to how life expectancy and fertility rates influence the aging population, and how combined with non-communicable diseases and changes in the family structure lead to the long-term care crisis. Because of its complexity, there are no quick and easy solutions, but we can still take some steps to minimize the problem and help the elderly live a happy and healthy life. As shown in this graph, due to the new technology and medical advancements, life expectancy is projected to continue its upward slope until at least 2050. On the contrary, the fertility rate shows a steady decline. In 2021, fertility rates in East Asia, Southeast Asia, Europe, and North America fell to 1.5 births per woman, which is far lower than the replacement rate to keep the population stable at 2.1 births per woman. As a result, the population of people aged 65 and over is expected to more than double from 2021 to 2050, while the population of people 80 and over, which is the age with the highest level of disability and requires long-term care, will almost triple in that given time frame. Japan is currently the country with the highest aging population, and in 2021, almost a third of the population in Japan was over 65. By 2030, nearly 24% of all Japanese are expected to be at least 85 years old, and this is one of the primary concerns in the country. South Korea and China are on track to experience the same in the coming years, and the rest of the world will soon follow. With the surge in the aging population, the old age dependency ratio will double in almost all regions during the next 40 years. This ratio represents the number of people aged 65 and over compared to the number of people in the working age of 20 to 64 years old. Europe currently has 4 people of working age for every older person, and the ratio will lessen to only 2 workers per older person by 2050. This shift will pose serious challenges to healthcare expenditures, economic growth, labor force, and more. Non-communicable diseases, or NCDs, kill around 41 million people each year, equivalent to 74% of all deaths globally. In 2019, NCDs were a cause of death of more than 80% of people aged 60 and over in Southeast Asia and the Western Pacific region. The elderly who are living with chronic NCDs will likely develop disabilities that lead to long-term care needs. Dementia, one of the most prevalent NCDs, is currently the 7th leading cause of death, and age is the strongest known risk factor. Currently, more than 55 million people have dementia worldwide, with nearly 10 million new cases every year. In the past, family members could have cared for the elderly, but due to changes in family structure, for example lower birth rates and increased rates of divorce, the family size gets smaller with fewer spouses and children available for caregiving, which put more need for long-term care. But despite this growing demand for long-term care, or LTC, this industry has long been facing a staffing shortage that has not improved much since 2011, with an average of 5 LTC workers per 100 people aged 65 and over across 32 OECD member countries. Although long-term care is essential, with its high price, many seniors would not be able to afford it without social insurance. Even a type of home care for low needs costs more than 50% of the disposable income of low-income elderly aged 65 and up, while home care for severe needs costs more than 150% of disposable income for all income groups. Let's look at the LTC crisis in the USA, the biggest LTC market in the world, as an example. In 2021, nearly every nursing home and assisted living community in America was facing a staffing shortage. Despite this shortage, the data shows that the Americans' need for LTC will almost double between 2020 and 2030, with 7 in 10 Americans aged over 65 needing LTC. All the factors mentioned create an LTC crisis that will affect all of us worldwide. Fortunately, there are multiple things we can do right now about LTC. Limiting risk factors such as overuse of tobacco and alcohol, unhealthy diet, and physical inactivity can effectively prevent NCDs and reduce LTC care recipients. Promoting social engagement among the elderly through work for pay or volunteering might be another way to help. Early screening is also crucial, since it can provide early detection of NCDs, and the early treatment will save time, money, and lives. High-quality care provided by LTC can improve the quality of life for older people. Increasing the supply and improving the LTC workforce is another approach to help ease the crisis. The LTC staffing shortage due to high turnover could be improved with an effective program like wages and benefits, recruiting and support such as new incentives, affordable training programs, and foreign trained worker support. Lastly, implementing technology into the task can provide more efficient and effective results, helping to reduce both physical and mental burdens for workers and patients. Many countries have already implemented technology to improve their elderly care. In China, there are mattresses to track the sleeper's vital signs, as well as robotic beds that transform from a bed to a wheelchair in Japan. Technology will not only increase the workers' productivity, but it will also reduce the costs and therefore the cost for the people in need of care. Technology can be the perfect method to reach remote patients as well. The aging population and the long-term care crisis have no fast and easy solution, but one way that can ease the problem is to solve the LTC crisis and achieve happy and healthy aging. Without long-term care to support the aging population, this burden will inevitably fall on the family and affect the world's economy and health. These are my references. And for my acknowledgements, I'd like to thank my parents for supporting me throughout this program and the Global Health Leaders Conference for this platform and amazing opportunity. I'd also like to thank Dignity Health for giving me the opportunity to work with the nurses and patients and give me valuable experience in the medical field. Kogir Alzheimer's Center is another area I'd like to thank for giving me the opportunity to understand more about senior living and long-term care. Lastly, I'd like to thank everyone watching for taking the time to listen. Thank you so much. And if you have any questions, please don't hesitate to email me about anything that interests you. Thank you.